So Hodgkin lymphoma, we cure most patients now, particularly young patients, 90% cures, which is great. However, we treat with a lot of chemotherapy. Often patients have a cumulative anthracycline dose of sometimes up to 300 milligrams per meter squared, which is a lot. And actually there was a really interesting poster at EHA here, which showed that for cumulative doses, the median cumulative dose in this population study was about 230 milligrams per meter squared. The hazard ratio for patients developing congestive cardiac failure was about 3, which is really quite significantly elevated with risk factors of diabetes, age, previous MI, but even the young sort of fit patient cohort, there was still an elevated hazard ratio. So we've got to be mindful of that. I think it means we need to give patients the information, how much anthracycline they've had. If we discharge them from follow-up, we need to be informing their family doctor, their GP, of the potential risks. What we do in Oxford is I say to GPs, please could you do an annual sort of check, look for high lipids, blood pressure check, and I guess jump on those potential additional cardiac risk factors promptly. Whether you need to sort of do echo surveillance every 3 or 4 years, that's difficult. It'd be really good to get some more studies of late effects. That's what we really need to ensure that patients live a healthy 20, 30, 40 years of life after chemo.